Good morning. My name's Penny, and this is Through Glass Eyes. We have Miss Priscilla with us this morning, and I want to thank you again, Miss Priscilla, for allowing us to interview you and for having the bravery to come on and share your story.
Thank you. Uh, it's my pleasure to be here, and I know that the job you're doing here is essential for the future and people knowing about long COVID, and I'm happy to be part of this channel.
Thank you so much. And Miss Priscilla, do you mind sharing where you live and how old you are?
So I'm Priscilla, but everyone call me Pri. So if be free to call me Pri too. I live in the south of Brazil. I used to say that to people that are not Brazilian, look to the Brazilian map. The last state is where I live, and the state is Rio Grande do Sul. I live on the really small city that we have um, less than 20,000 people living, and um, I'm 31. Yeah,
Very cool.
31.
Thank you so much. I was guessing early 20s. I'm not going to lie. You look very young. And again, thank you so much. So, Miss Priscilla, we're here to talk about your long haul COVID journey. But let's talk about before you got sick or the infection that caused all your symptoms. How were you before? What did you do? What type of person were you?
I'm I have this thing that all people uh feel about COVID, that we all change, and it's like we don't remember things how it was before COVID, but I have a really important thing, that is I am autistic, and I have mental illness that I did not knew, and that start my journey with doctors. And I remember before COVID, I have this job at the pharmacy of the free healthcare system, and bad things happen that I I end up on the psych my mental health doctor. I forgot the name. Psychiatrist? Forgot.
Psychiatric or psychiatrist?
Isso, yeah, this. And I asked my demission. It was like horrible being there, and because of that place, I end up on a psychotic break, and this kind of was my life from 2018 to until COVID. That it was a really crazy experience. Um, Even for us in a small town in Brazil, a small city in Brazil. And most of my memories have to do with the fact that I was having extreme crisis and extreme uh, things going on with me, that it was about autism and ADHD, and I I did not knew my neurodivergence, and this became like catastrophic. But I think that is the first thing I remember, and I used to say that at my bad times I just remember surviving. One day. Uh, uh, one day at a time, and I just remember surviving, and I look of my pictures before COVID, and I look and I think, who is this girl? You know, sounds like a girl that live on a bubble, that um, it was completely lost about the about reality, re, the real life, and I did the I can look that old pictures because sound like Alexa, para. Sorry, it's my Alexa. Uh, um, uh, I don't know who that girl or, because at that time I developed an eating disorder. So I was really, really skinny. And today I look to my pictures and I see the despair. I see that that version was suffering, but she didn't know why. And then my memories before COVID are like, I love books, I love studying hours, and I have really, really dark things going on uh, before this all happened.
I'm so sorry to hear that. I'm so sorry. I'm so sorry that any of us have to go through anything like this. And it takes a lot of strength and courage to come and share your story. And again, first and foremost, I want to thank you for that. And just to tell our audience at any point, if you need to take a break, we can certainly pause the video. We can take a break and come back, okay? And
Okay.
let's talk about when you got infected. What were your symptoms? What happened during that time? How long were you sick for that specific infection?
Uh, my dad was working still. Now he retired, and at that time he was working, and the company pays for his health checkup, and he got COVID going from the company to the health checkup. And after this, me and my mom get COVID. And to be sincere, the first time I don't remember much. I just remember that the doctor said that I need to go to the hospital, but there are people really worse, that he knew my mom and I will take care of myself at home, and that people they don't have it to how to take care of themselves. And I just remember waking up, going to the couch, get my cell phone and scroll, trying to, I don't know, distract myself, because the only memory I really have it is the inside of my hair burning, like it was fire be around my brain, and it was just insane. It was fire this whole 2 or 3 weeks, and it was crazy. And then my dad get really, really bad, and he goes to the hospital. And I think it was 15 days he get to the hospital. So it was me and my mom would cover it, my dad at the hospital, and we were, really anxious, really bad. And the only really strong memory I have it was the doctor calling and saying, this is our last attempt. We will give him the last med we can try. And if this didn't work, he will die. The doctor said like this, I can sit here and tell you, nice, cute things, but that is the truth. I'm sorry, that is the truth. And I just remember my mom hugging me and holding me because at that time I just want to beat my head at the wall and just passed out. I just remember this. My dad is okay. He survived. He get some
Oh,
lung
thank God.
problems, but he's fine now. But from all that first infection, I remember this, my head burning, and the wanting really hard to beat my head against the wall and pass out because I can't take it no more of this. And when the with all passed, I started to have some really weird things going on, and it was when my journey begins. You know, I think I have it more than one time, but um, at the healthcare, they said to me, get here the test, uh, go home, stay home, and do your best. It was like that. Stay home and do your best. I have, I think I got more than one time, but I I don't know because I didn't have the full, uh, you know, checkup and the whole process.
Wow. So you said your head hurt for 3 or 4 weeks. Did it eventually stop hurting?
Actually, it stopped hurting, but the problems begin there to the extent of I don't have how to go, how to get up of my bed without looking like I run a marathon because I can't take it. My mom, it's 67 years old, and she have to carry me until the bathroom because I just can't do this alone. And after that, a lot of things with my health start to happen, and we are here now.
Do you mind sharing? So lots of things happened. Share with us that journey. What happened first? And when you went to the doctor during everything started or starting, I'm so sorry. When was the point you went to the doctor and how did they respond to these things happening? And then share
I
with us the rest of that journey to where you are today.
I have some mental illness, and that is on my medical records. So when I go to the doctor, no matter what, it was always anxiety or go back to your doctor. And for 3 years, it was like this. The things start to getting bad when I get really dizzy. My vision like a blur, and I start to have uh, accidents, falling and beating my head. I used to say now I make bad jokes with all of this, and when people say that something is dangerous, I said, well, I beat my head 5 times, go back to sleep, and wake up fine. So um, I start to have this falls, and I beat my head, and I cannot think at that time. I know I should, ask for help, call my parents, but I just want to go to my bed again. And it was 5 times, and then I have a period I was really dizzy, and my parents have to carry me to the doctor, and I go to the emergency, and they make me some IV meds, and I go back home, and he was like, look, this meds, you have to take it for the rest of your life, some for a week. And this escalate, I start to have uh, extra crisis, a mood crisis, and start to have extra symptoms and pain all the time, to the point I take three different meds that my doctor, uh, m- tell I can take it, and it just make it bearable. It just make it bearable, and actually until today, I have to get used to the pain, and I said to people, I will not stop my life to be complaining, because if I start to say that, I will use all my day to say what's wrong with me. And I have no problem to hear other people and no problem with other people saying, but my choice is like, I will live my day here, and people around me knows my what's happening, knows what what's wrong with me, and they respect it. And I share my experience in these moments. I used to record videos, but now my energy is all to my doctorate. So I share my experience in moments like this, but in my day I can't. I really focus on other things, and I just don't talk much about this. But I start to have pain, extreme pain. I start to have this cognitive symptoms, and randomly I lost control of my movements, and I did a lot of exams um by the free healthcare system in Brazil. It was like they pay for all the exams, really expensive exams, and doctors like it was all on my head. It was all in my head. Go back to your doctor. Then I was on a consultation with my doctor then, and I make the joke. I said, "Look, doctor, they are telling me that I'm crazy, and it is uh the reason things are happening. You know I'm crazy, and that's not the reason." And then he laughed and say, "Look, tell me all your exams." I tell everything. I handed him all the results, and he looked and said, "I will give you an MRI of your head." And then 20 days later, I find out I have a brain tumor. I'm not in danger, but at the same time, I can be on surgery, because he is on the place that if something got wrong, it'll be affecting my cognition and my movements. So I'm just living, and they will only make something if threatens my life. But at that moment, my mom gets really angry, and she starts to go on my consultations, and when people my appointments, and when people doubt of me, she was like, "No, no." And she started talking for me when people don't believe me, and that really um changed things. I was on a list to consult to be on an appointment in my state to a neurosurgeon, and then I prepare like 10 pages of my symptoms, and I look, and he looks like this, less than 2 minutes. Then he looked to me and said, "This is not of your brain tumor." Then I was researching, I was looking everywhere to know what's wrong with me. That's something that my science career just gave me, this natural uh, research thing. And I looked to long COVID and I said, well, it's all there, all my symptoms. Then I looked at the doctor, uh, basically in despair, and I said, doctor, the only one hypothesis I think I know right now is long COVID. Then he looked at my face and said, yeah, that's your symptoms. Then I said, well, what can I do? And then he looked at me and said, well, that there are no treatment. You need to go home and wait. We will pass and you get fine. Just that was my first long COVID contact on healthcare system. And I know right now that just no doctor knows about long COVID. No doctor research. Right now, at my city, I have a really good doctor. Really, really good. And he loves to learn. He's, he seen me on the appointment they did. He was like, yeah, I love to learn. So he asked me questions, and he actually have a group of doctors that they make meetings to share things of their patients. And he got my case and to this meeting, and they basically confirm long COVID. And he was actually researching about, and he was really, really interested, focused to help me. And that is like a relief to me because I'm used to doctors that don't look in my face because I have mental illness, that I cannot speak freely like here, that is schizoaffective disorder. And they look to me and it's like, she's crazy, she must be lying. Yeah, it's like this. And also she's a woman, it's all in her head. It's a classic. But right there at the consultation with the neurosurgeon, I decided, okay, people, they are not even researching about it, so I will have to, be uh I will have to research, test. I will have to. I don't know. I will have to find out how to get better, and then I start to read. I learn a lot for on other patients. When the people share their stories, they have perspectives that I didn't have, and sometimes I found answers that best that on the medical books or some science article. And then I start to compilate all I know and start to, put in my daily life these things, and I get better enough to finish my master degree, and now I'm my doctorate.
Congratulations on that. And I'm so sorry to hear about your tumor. Um, so before I got infected the first time, I found out I had colon cancer. And I think I had gotten COVID. I got it in October of 21. That just seemed like a cold, but I'm sorry, October of 2020. And then in January of 21 is when I got the infection that I think really affected me. And let's back up for just a couple minutes. I've been writing down questions so I don't forget. You said your parents both had COVID, and thank goodness your father is okay. I've lost family members that weren't okay. They went in the hospital and never came home, unfortunately. So thank God that your dad is okay. Does either of your parents have any lasting effects from the COVID?
Yes, my dad lost 25% of his whole lungs. Lungs. I don't know if I'm having the correct pronunciation. And he has to use a lot of meds now because his heart was also really affected. And he takes a lot of meds now, and he's okay in his own way after COVID, but yeah, they are fine now. My mom has finished her brain cancer chemotherapy and brain cancer, no, sorry, breast cancer chemotherapy, and she's also fine now.
Oh, thank goodness. Did your mom get the breast cancer after she had got COVID?
Yes, she get it, and she wait, I don't know, 2 months on the line. Then she was called to the capital of my state. They make her surgery, and she started radiotherapy, radioterapia, and after that, she her chemotherapy is by pills, and now she's okay. July next year, she finish the chemotherapy.
Well, we're going to pray that everything goes well with that. I can't imagine having to deal with that too. It's a lot. And I'm very grateful to hear that not that your parents went through the COVID, not that they have the problems that they're having now, but I'm grateful that they get that side so they can relate with you versus, trying to figure that out because there is a lot of people out here that don't even have that kind of support from family members. I was talking to a young man the other day that lives by himself, and he was talking about how his family life wasn't so good, but he's lost his job and he's having to consider moving back home, and that's not something he wanted to do. So that's hard, but it makes it easier when you have a good family, and it sounds like you have an amazing support system, and that certainly helps. You were talking about your mental health, and I really just lost my train of thought. Hold on for just a second. When you got infected, did you notice that your mental health had gotten worse? Is it worse now? Like, are you more, like, I know you're more in tune with yourself, but does it seem like it's exasperated, like it's hypersensitive, the mental part? And if so, tell me about that. What has changed for the worse, I would say, because of the COVID when it comes to your mental health?
I always said that uh, during COVID, my body was really focusing on the virus, so my mental health was kind of okay at my own terms. And after that, I changed a lot my treatment, and this really gave back to me the capacity of do normal things. But uh, before COVID, I received my diagnostic 2017. So I was 3 years with my treatment, and then COVID happened. I got really good meds, but they stopped working, and then I have this cycle of changing meds. And today I live with my mental health, like making bad jokes and just accepting. I don't hide. I I understand that a lot of people that have schizoaffective disorders don't talk about it with people, don't share. But also, when I share and I accepted that I'm not ashamed of who I am, I feel this relief. It's like I don't care what other people think right now. I care that I'm being myself and I'm sharing, and in some way people find me and send me messages. I make a lot of friends that have the same mental illness, and this really helps me in a way that I share something and people uh, just read or see the video and they thank me, and it's like I'm less alone, and I have, if I help, I feel that I have this purpose that help me to live everything. It's like if I can help one people, it's like okay, I'm relieved uh today, and I can, talk about, and it's like less painful to deal with my mental health and my physical health if I feel that in some way I can help another people to learn about it.
Absolutely. And I guess my biggest question that I get asked because of the mental health, the emotional, I've never had problems controlling my emotions, and I find that I cry more. Things affect me more, things that never bothered me before. And I actually just asked my doctor to up one of my meds because, emotionally, I'm just not in control sometimes. And that's very hard because that's not normal for me. And then, oh, it's just I'm sure you have the same thing that it's just like you said, where's that person I was before? Where, we seem to mourn that person because now we're having to adapt to a whole different life, uh, a whole new lifestyle, basically, right?
Yes.
And Miss Priscilla, you talked about some pain. And can you talk about that a little bit more? Where is your pain? And when you talk about all the time, consistent, nonstop, what do you do for that pain?
Basically making uh, a compilation of things I used to say. Everything in my body hurts all the time, but especially my muscles. And actually, the doctor told me last year then I probably got fibromyalgia from all of this, and I also get an immune disease on my blood, and then I can take one med that do not it's not dangerous, and this med barely make things uh bearable to me on all the time, and it's especially the muscles, it's all the time, always. But I have this thing that I only take meds or another thing if it's really bad, because I it's my routine now, and I just it's weird and it's sad to say that, but it's real. Uh, it's my routine now, and I just get used to this. I have my emergency meds here, but really I wait to get really bad to take the meds. But yeah, it's all the time, always on my muscles, and I have to make a lot of checkups now and about my blood and vitamins and everything, and it's been really messy. Uh, I don't remember how to say it in English, my blood disease, but it's basically I'm trying to go to my laptop here.
No, take your time.
The hypothesis of the doctor is that my blood is trying to find out the virus and is trying, to kill them, but got he bugged on that and he destroyed my blood cells. I'm just, yeah,
While you're looking, while you're looking, if you don't mind, I'll go ahead and share a little bit of my story with you. So in January of 21, when I said that that's when I think it affected me the most, I could barely walk for 6 days. And I only had like 8 steps to the restroom, and it was so hard to do that. And after I got better from the not being able to walk, I had this lingering light body pain. It felt like mostly it was in my bones and muscles of my calves. And I kept going to the doctor and I'm like, something's wrong. And slowly over the 5 years, it's gotten to where, like you said, it's all over body pain. I have pain meds. I stopped taking the muscle relaxers just to see if they were helping. Nothing changed. All they did is make me tired. I stopped taking those. And I take the pain medicine just like you do when it's bad. And I just want to go to sleep because really, I think that's mainly what it does is really just helps put me to sleep. And even when I take the depression meds or anxiety and sleeping pills, I don't know about you, but I don't sleep very long. Maybe an hour and a half and I'm wide awake. And then I'll eventually go back to sleep and I'll sleep for a little bit longer and I'm wide awake again. But I'm sure you can relate with this as far as every day is different. We never know how we're going to
yeah.
wake up from one day to the next, the pain level from one day to the next. And it's hard to control that. And we just learn to kind of adapt to that. Does that sound familiar? The pain wise and stuff like that?
It's really hard to accept that I am not in control anymore, and I have to, work with my body to don't stop my life completely and, feel that I lost things that I want to do. I found the name, but I have difficulties to speak even in Portuguese. It is immune thrombocytopenia. Yeah.
It's kind of spelling
Basically,
it out on the bottom for it, so that helps out too.
I will send you the name, I think, because it's really complicated here. Actually, my blood attacks my plaquettes and destroy enough to my doctor suppose that I may have leukemia. And uh, the funny part of this, or sad, depends. My best friend is finishing her medical degree, and then she gets really annoyed that the doctors didn't listen to me, and then she gets all my exams, my lab results, and she spent like a lot of times because my faculty pays for them the best sites to access science articles, and she gets really mad, and she find out that I have this disease, this autoimmune condition, like 2 or 3 months uh, before the doctor. So I used to say that she really saved my life for this, and I'm really grateful of having her as a friend. And she's really a good part of things that really helped me. I find out with her help, and it's really amazing to me. And this is one of the consequences of COVID. And also, I forgot to say before, but the brain tumor, my doctor said that I born with him basically, but COVID accelerate her growing, his growing, and that was the reason that I got really bad. And actually, again, it's that so it get really bad, and now I'm here trying to survive just.
Absolutely. You talked about how you lost control of movement. How did that look? And how is it now?
I have this extreme episodes that I remember the first. I was waking up and I will go to my bathroom, and I just remember I stand up and I just fall on my knees, and I try to put my hands to so I don't beat my head, and I put my hands and don't they just I just fall out like basically a doll falling out, and I can I at that time I can't think right, and I just go back to my bed and sleep because I don't remember even that I need to call my parents and ask for help, you know. And that happened like 5 or 6 times. One of that times, my dad and my mom listen to me falling out, and they get me back on my bed, and they were like, keep be awake, don't sleep. And I was like, okay, I will sleep. If I die here, it happens. I just remember I want to go back to sleep, and I think this, I don't think, well, my life is in danger, I need to be here. I just think I need to go back to sleep. If I die, I'm sorry, it happens. So I go back to sleep, and look for. I'm really lucky to be here. And this year I have an episode. Then my dad and my mom helped me, and I think that I found out what happened at that moment, because my blood pressure was like 4 to 5, or like something really really bad, and my heart was like really really bad too. So I was really, my mom was trying to hold me awake, and I was like, I just remember that I don't have control of anything, and I want to go back to sleep. And my dad and my mom, uh, they were panicking like more than me. They are like really anxious, and I just say to him, I will back to sleep. And then they keep monitoring me for the whole night, and uh, I it was one of the times that I said, well, and I almost died, but I don't die. So uh, it's here. I have a lot of heart problems, some also after that my heart gets really, really, really fast. Then uh, they get really slow, and this also causes me a lot of problems. And some days I was numb, my body was numb, and at first, in the beginning, I was really, really scared of this. And after I just get used it was my routine. So I just, you know,
Absolutely. And I understand that part too with the fast and slow heart rate. In July of 21, I actually had a stroke. I had woke up one morning, got right in the shower without thinking, I had an appointment or something. I can't remember why I did it so early. It was like 5:30 in the morning. And I got in the shower and I did the shampoo and I went to do the conditioner and my body started tingling and doing this weird, like my stomach was, I can't even explain the feeling. Like I knew something was wrong. And at that time, I had a shower separate than a tub. And I remember getting out of the shower, soaking wet conditioner in my hair, and I got to the edge of the tub. And that's the last thing I remembered until I woke up on the floor. And thank goodness we got to the hospital in time. They gave me medicine that stopped this from the lasting effects. I don't know how all that really works, but we did find out that COVID had taken my normal heart rate in the 70s down to 50, and at night it was going into the 20s. So now I have a pacemaker that keeps my heart rate at the least 60. But now the fast heart rate. So now I'm on medicine for the fast heart rate, but it keeps happening. So that's something that they're investigating right now and keeping an eye on because it's happening more and more. And it's kind of crazy how all that happens. So I'm so sorry that you have that too. It's very hard. And by listening to different people's videos, and this is the main thing I hope to do is share that for one, not a very few of us can even say we have the same symptoms, and it's not even the same all the way. I watch a couple different doctors, and one of them talks about how a lot of people go into Facebook looking for answers or Reddit, and they see all this stuff that other people are trying, so they're trying it, but that's not the way to do it. What they're saying is you need help for each thing individually in order to get through it. So I see you're doing the research and that's the most important thing is I feel like we have to advocate for ourselves, not because any of the doctors are doing anything wrong, but because it's so new and because so many doctors don't have the time to do research on new things or whatever the reason is. No fault, it's a lot. And it takes a lot of dedication, to do the research to really get down and dirty and see what all is going on. And I'm not in any way, shape, or form anything medical. I'm not a doctor in any way, shape, or form. I do like you do. I Google my symptoms. I try to figure out what's going to work for me. And that being said, that same doctor that I'm watching, he talks about the supplements and how it's hurting some people to take them. So people have to truly be careful with that. So I go to things that I can control. Do you notice foods, for example? Are you having to eat different? Is that certain foods that you used to eat, is it making you have crashes? Or are you noticing different stuff like that?
actually, with food, I have a really complicated relationship. And the only thing that really happens is sometimes I can't I can't eat because I'm too tired to eat. And then I know that if I look to food and I feel that I don't have the energy, I cannot eat. So basically, on really bad times, I take it's all liquid. I cannot take any type of normal food. Let's just put it. And it really the only thing that really bothers me. It's look to the food and knowing I will I can't, I'm too tired. I don't have the energy, and in the same time as I deal since childhood with an eating disorder, this get really bad to my mental health because I'm scared to going back to that place uh, uh, where I was not eating my but by my choice, and now it's not my choice, but at the same time it's that feeling, and it's the only thing that really bothers me.
Wow, thank you. That's the hard part too, is the food. Um, I had, oh boy, it over a year I've been vomiting, and it was just once every once in a while, and then it became like once a week, and then it became a couple times a week, and then it became daily, and then eventually it became where every time I ate, everything was coming up. And a couple weeks ago, my pulmonologist, I went to the doctor because I was having, or the emergency room because I was having chest pain. And my pulmonologist looked at my scans and they sent me home, said there was nothing wrong, but he looked at my scans and said there was inflammation. And he thinks that I was having a, oh Lord, I forgot the word. Um, like everything was inflamed. It was just so he sent over some steroids. And that was the first time I've eaten in over a year. And it was like I was so hungry. I was constantly like picking. It wasn't a lot of food at once, but it was a lot more than what I'm used to eating. So now I have to retrain my body to eat again. And that's the hardest part because, when I go to the doctor, they're like, well, what do you think caused it? I don't know what caused it. That's why I came here, and they kept giving me medicine for nausea and vomiting, and it wasn't working. It didn't work till I went to the doctor and or the emergency room once because I just couldn't keep nothing down, and they gave me Reglan to keep. And that was the first thing that helped to keep it down. And then, like I said, something happened and I don't know, I'm able to eat again. But it's very scary and it's real, and it's hard to, right? Because you want to eat, but you're tired. And you want to eat like you normally do, but you might have to change, like spices are messing with me. We found out processed foods are not good, which I knew that all along, but that's easier, right? But my caretaker, he'll come and he prepares food for me from scratch, and it works. It works better than a lot of the other stuff, but we have to be careful for spices. So that's kind of sucky too. It's a horrible thing. Um, Thank goodness for your friend. She's amazing, right? She's going to be a doctor, and you're already helping her get a leg up on all of this. And it's so amazing that she's taking that time and she's learning. And I can't imagine how many people she'll be able to help because of you, And I think that's really awesome that you have a friend that pays attention and really, wants to learn all this stuff because I can't imagine how hard it is.
Yeah, for a lot of time, she was the only one that believed me, believed that it was not in my head. She's also autistic, and she really, really take a lot of times to help me. And when doctors don't believe me, she actually type down my symptoms with my lab results, and she basically make an article with her hypothesis and with my results, and tell me to give to the doctor. I'm really lucky to know her.
That's really awesome. Really, really awesome. You said that she was the only one who believed you at first. How did other people treat you at first until they got to, even when you meet new people today, until until you're able to share your story, how do they treat you?
Actually, she was the only one on the health, ambulance and the health care work that believe me. I'm really lucky to have my parents. They are awesome. They always help me and believe me. They are like I'm really, really lucky having them. A lot of people at first just judge me, don't believe it, but now that they see, the results, uh, daily life and the consequences, they help me. They don't judge me, and I'm really antisocial. I stop most of my social interactions, even by message, because I was spending all my energy talking to people all the time. And I have to, cut it and focusing on my family, job, and study people. And I really it's not isolation, but I'm really okay with I'm doing now, and I get really, really better because of this. I was uh that the one friend that listened to everybody, that give advices, that was at the middle of the night giving advices, and that was draining me. And at first I feel kind of bad of don't interact with a lot of people, but my therapist helped me to see that it was okay. I'm not responsible for that people, and I talk to them, but really, really uh, messages. A few messages, in a period of times. Sometimes it's months until I answer a message, and I make, a really big message explaining the situation. And I said, look, I don't have energy. I'm really bad. I'm sorry, but I'm not answering all the time. I can't, And after this, I get really better because my energy was focusing on my health, my daily life, and I stopped to be sociable, but not for, you know, a choice, more like for my health and in general.
Now, you you're taking classes and you do research on your symptoms. How has COVID affected the amount of time you spend doing your research or maybe your homework compared to what it was before? Do you notice there's a big difference or any kind of difference?
I was the kid and the teenager that read 8 hours, you know, straight. I lost count of time studying. I was this that person, and now I get really, really frustrated. I got 1 hour, and then I go to my bed, because I can't even get up. It's over, more than 1 hour. sometimes when I'm hyper focused, I study, I don't know, 3 hours and I get 2 days really, really bad on my energy. And I think this was the worst to me. I can take pain, I can take all the symptoms, but I can do the thing I love the most for some time, and this was really what uh, make my mental health worse because it will. I love my books. I have more than, I don't know, a lot of books, and I have to stop reading like for some 2 or 3 years, and that was the worst to me. Uh, the reason of a lot of mental health crisis, and yeah, this I think from all of the things happened, this was the worst.
Absolutely. I couldn't tell you the last time I picked up a book. And I used to have, when I was growing up, I had my own little library. I had all my books in numerical or alphabetical order. I was that person. And I do. I miss a nice hardcover book, but I know I can't sit and focus. Reading is hard. I think the hardest thing for me is that focus on it. And my job, I do a lot of reading, and some days are worse than others. And I take a break early so I can take a 15-minute nap, or I might take my lunch early and take most of the time I like 30-minute lunches, but I'll have to take an hour and a half lunch sometimes just because whatever I'm doing or however I woke up made it worse that day. And I'm just that much more tired. So it makes it very hard, especially for the things we enjoy. And I used to enjoy just being around people, and now I kind of just don't go around people. Not so much that I don't enjoy people, I still do, but I think, more of the fear of getting sick again, And it's not only just COVID, it's the normal cold. I just went through about a bronchitis, that caused an ear infection and um, uh, inflammation in my lungs. So I just literally, I'm still dealing with a cough from that. But I am on day 4 of antibiotics, and my ear finally felt started to feel better last night. But it's crazy how the simplest things that used to didn't put us down is now putting us down if we go somewhere, and that's what makes it, I think, the most frustrating. I don't know. No, I can't say it's the most frustrating. I think the most frustrating part for me is the walking. I can walk short distance, and now I have an electric wheelchair for long distance, and I'm like, wow, I'm not that old, I want control back. And losing that control, I think, is probably the hardest part for me, because it's certainly nothing we asked for, nothing that we can figure out. We're just learning just like everybody else, right?
It's like we have control all our life, and now uh, we don't have any control. I don't make plans anymore. I don't.
Me,
I don't. I don't create expectations for nothing, and I'm just like I can't. Yeah, and it's that part that it's hard to me. I can't. I don't have the control of my own body, and it's exactly what to tell. It's it's really bad.
absolutely. And before, you said you struggled day to day, and you also said you have to change your frame of mind, right? So you're not focused on the pain. How easy or how hard was it to for you to do that transition? from the focus on the pain to the focus of, I'm going to figure this out?
I think I used to say that what motivates me is rate of seeing people that can help me and chose to don't help me, and I just stop trusting anyone in the healthcare system, and I said, okay, you don't you nothing is helping me here, so I will research. I will make me a new routine. I will make everything to me, and it was truly frustration, hate, and I was angry all the time because people that's supposed to help me just say go home and wait. We'll pass this, and I will. It's not. So I get really angry and start to research for myself.
How many times have you gone to the doctor and you start explaining your symptoms or what's going on and you get that blank stare? Ugh,
Well, not much of a blank stare, more that's not happened, it's not possible. They always said that, and uh I am the doctor, you are the patients, that's not possible, don't happen. And I think it changed when I get my lab exam and my MRI from the brain tumor, because people used to, that thing that they look to you and they kind of say something and start to laugh. And when they got my MRI results, people was like, "Hey, how you doing? So we have here this for you and that." It was like all change, and I was like, "Really?" All changed because now I have a brain tumor. And before it was all in my head, you making this, you wanted attention. It was all of that thing. And when now that they know they messed up, I have the medical records, they know they messed up, so they are like super nice, helpful, all changes, and that make me even more angry than before. And I start to research. Now that there are a lot of AIs that just for medical knowledge, and I start to put my symptoms there. uh the Stanford one was that make me relieved, because basically I found out that I'm not dying from my brain tumor. I can live and die old, uh because the doctors just ignore everything, and I have to research.
absolutely. And how does that make you feel where we know it's brand new? We know it's affected more of this world than they're sharing, of course. How does it make you feel when you go to a doctor and first of all, they don't believe what you're telling them, right? Because they don't have your records yet. And then when they look at you, how frustrated are you? How do you feel when you leave that office and it leaves you like they don't believe you, they're not, how does that make you feel?
I got really disappointed at first, and then I I looked to all the situation and I said, okay, they will not change now. I go research about, another scientist, something that are, I don't know, trying to make a study about it, and it was really, really not bad, but a little few people like it was at the first studies, and we have a long time until we got really consistent results. And I looked at that, professionals, and I said, okay, they are not even trying. So now when I go to the doctor, I go prepared for they have this bad behavior. They dismiss my symptoms, and I just go. I try to not be combative. I try to not go like ready to go full Karen to the doctor, but I don't trust doctors anymore, and I don't trust things that they say. And I go to my friend, my poor friend. I go to my friend and I tell her, okay, the doctor tell me this. It is true, because when she tell me that it is true, I follow, because she was kind of she she cares. It's different, you know. And I don't trust anymore doctors, and I don't trust uh the system. Brazil have a really good system, a health system. Uh, I got, life-saving treatments for free, but as always people are people, and they bring this mentality that it's all in my head, or it I want attention, or I don't know, something random, and I don't trust anymore anyone, because um, before all of this, at that job that I said, it was um, traumatizing. I was seeing the intern dynamics of a healthcare facility, and I was just, okay, I can't trust people anymore. I can't. I just can't. I cannot trust uh, people, because I see what was happened, on break time, on, what they said. And I get really sad, because there are a lot of people out there on the health field that are really good people that care and help. Uh, like my doctor now here in my city, but a lot of people really don't care, and they just look to me and said, "Well, you're crazy. It's not true, you know." And I got disappointed at first, but now I kind of go to the doctor, tell the basics, and tell him to, go to my medical records. They have it complete on the system, and they can, open there with their laptops. And I don't trust speaking with them like we were having this conversation. I don't trust that I will be uh, they will believe me if I talk openly. My doctor now, he is really nice, a great person, and I entered in my first appointment with him, and I said, "Look, you sounds like a nice person," and then narrate all my the dynamics with another doctors, and I said, unfortunately, I don't believe doctors anymore, and I'm sorry, but I not trust in you. I'll not trust that you will really help me, and he don't answer it in that negative way, but I start to observe that when I go back to my appointments, he make me questions about my health, and he kind of research. He really take time to research and things that um, can help me, and at now I can talk to him openly, but a lot of the professionals like don't really care, and I got at this point that I will not believe it or trust and get disappointed always, because I don't have the time or energy to feel disappointed and take this time and energy, and I put on another things, that can help me.
Absolutely. That's very, very important. Have you done any clinical studies? Do they offer them there?
Actually, most of the doctors don't know what it is long COVID. you know I have to take here's my symptoms, here is long COVID. They don't know, they look to me like I'm speaking some Greek language, something, and um I am on the list for a clinic that happened. It is at the capital of my state, that they deal only with really rare cases and syndromes. And I asked them to go on this list, but in my state, uh, we don't have a clinical trial. No, we don't have it because you as I said, they don't know about it. My doctor tried to make a lot of indications of doctors, and the responsibles, for the state answered that I don't need these doctors. It's not really bad, and my doctor can, find some way of treating me, so they didn't accept me go to some specialist, and it's really really expensive. Got a doctor that know about long COVID, and um, most of them don't have any connection uh, with anything that could make this less expensive. So I research, and my doctor now, he really, really research and try to help me as he can, and he's really awesome.
That's really good. I'm glad to hear that you have that for a doctor. Now, just to go back just a little bit here, originally when you found you got sick and everything, you didn't know about the tumor. So I know my answer for this. So when it was just long haul COVID and then it went to plus tumor, how were you treated different? Is it more like when you go to the doctor now, the focus is on the tumor and that's kind of where they focus? Or this wonderful new doctor you have, it sounds like he's listening more. But first, before him, was that, like they kind of didn't know what was going on, and then you got diagnosed with the tumor, and then the focus became on the tumor. It something like that, and that's when they started really looking at things.
Actually, I got really lucky uh, that my doctor don't have this focus only at my brain tumor because I have the neurosurgeon there. So he focused on basically the COVID consequence, blood, blood test and these things, because uh, it's that part that he can help me. So he has that focus. I just noticed just this difference when people know that I have a brain tumor. All people around was like looking to me like with that memorial service look as I'm dying, as you know, and some people that are close to me, I just said, look, if you don't stop to use this face, I will make the worst jokes about my dad possible until you know, you get really feeling bad. So my friends that know I will do this, they stop it and I gave them full permission to make jokes about it, and I live like it is a real joke to me, but I feel that people gave that classic, oh, now it's a physical illness, it's not on your head. We have the lab results, now you're really, really sick. Before it was, all in your head. Now you're really sick. And I'm not the one that will really talk to people, create that fight. But I was clearly looking to people like with the depression. Really, now you care. Now you care. I spent 3 years listening that I was crazy when I have a brain tumor growing up in my head, and you are ignoring. You are making that that laugh that the people are talking to the other. They look at you. You give that judging face, and now I get there and they all, how you doing, how is your week? And this is another thing that left me really angry about it.
Absolutely, absolutely. Um, uh, what is the biggest advice that you would give somebody that's going through long haul COVID symptoms, regardless of what the symptoms are? What would be your biggest advice to them?
Don't don't judge yourself when you cannot do things, even if it hurts. That's not your value. You know your value are not in things that you can do, you know, because we have this tendency to know, I need to be useful to be, a person, to, have a sense, have a purpose. Eh, I'm kind of being, uh, get confused. And that's not. your meaning, your more than things you can do. If your doctors don't believe you, look for places like now we have AIs that focus only on medical articles, research, ask for help. Something I did when I got my brain tumor lab result. I look for, even American neuroscience, labs, and I was sincere. I sent them emails, and I said, "Look, I have this thing. I can't found, nothing about it. Please help me. I don't know, book titles. I need help. Ask for help from people that will not dismiss your symptoms. And we have some problems asking for help also. So please ask for help. Someone at this path will help you, will, give you the support, and don't give up trying. I take a lot of times to, really found what helped me. So I research science articles, but also go where patients are sharing and make questions and read what other people are saying, because doctors can help you on, the biological side, but only other people that are living this really knows what truly happened.
Absolutely. And Miss Priscilla, I do want to thank you again for coming on today, for sharing with us. In a couple months, I'd like to check in with you again if that's okay and just see how you're doing and
That's okay.
just go from there. I'm going to go ahead and stop the recording and then we'll continue to talk, okay?